Hi, my name is Victoria Gijon, and I'm going to talk about the treatment of endometriosis-associated pain with elagolix, an oral gonadotropin-releasing hormone antagonist. First, I'm going to talk about endometriosis. It's a condition in which the layer of tissue that normally covers the inside of the uterus grows outside of it. Most often, this is on the ovaries, fallopian tubes, and tissue around the uterus and ovaries. However, in rare cases, it may also occur in other parts of the body. Epidemiology. It most often occurs in the ages of 30 to 40, and 8 of 10 patients with infertility has endometriosis. 12% of women has infertility problems, and most often occur in women who live in the urban area and has a stressful work as occupation. Now the pathology. The exact cause of endometriosis remain unknown. Many theories have been presented to better understand and explain its development. The pathophysiology of endometriosis is likely to be multifactorial. The theory of retrograde menstruation, also called the implantation theory or transplantation theory, is the most widely accepted theory for the formation of ectopic endometrium in endometriosis. Here's a video in which explains what is endometriosis.
Endometriosis is a disorder of the female reproductive system. The uterus plays an important role. Each month, during a woman's menstrual cycle, the endometrium, the inner layer of the uterus, grows and thickens to prepare for implantation of a fertilized egg. Then, an egg is released from the ovaries and travels to the endometrium. If the egg is not fertilized, the endometrium sheds as a normal part of the menstrual cycle. This is commonly known as the period. In girls and women with endometriosis, some of this endometrial tissue does not exit the body during menstruation. Instead, it becomes attached to organs surrounding the uterus, such as the fallopian tubes, the ovaries, or the large and small intestines, creating lesions. These respond to the monthly cycle and also shed, causing a variety of symptoms. These symptoms include killer cramps, chronic pelvic pain, bowel problems, painful sex, and even infertility. The earlier endometriosis is diagnosed and treated, the better the results. If you think you or a woman you know has endometriosis, a physician, preferably a gynecologist, should be contacted.
Now, signs and symptoms. Pain and infertility are common symptoms, although 20 to 25% of women are asymptomatic. Well, pelvic pain is a major symptom of endometriosis. The pain can range from mild to severe cramping or stabbing pain that occurs on both sides of the pelvis. Infertility is about a third of women who with infertility has endometriosis. Among women with endometriosis, about 40% are infertile. Here's a video in which explains why the endometriosis causes pain.
The cause of endometriosis is unknown, but we know why it causes pain. Basically, the outside of your uterus acts like the inside of it. It thickens and breaks down during your menstrual cycle. But since it has nowhere to go, the tissue becomes irritated and the patient experiences pain. With moderate to severe endometriosis, these inflamed areas become fibrotic and scar-like. They develop their own blood supply, which allows them to grow and spread. At this more developed stage, endometriosis actually begins to distort the anatomy. the function of the ovaries and the fallopian tubes can be compromised, making it difficult for a woman to become pregnant.
Now, elagolix. Elagolix is a highly potent, selective, orally active, short-duration, non-peptide antagonist of the gonadotropin-releasing hormone receptor, which is under development for clinical use by Neurocrine Bioscience. The action. In this video, it explains how it works.
The serum levels of estradiol and progesterone are tightly controlled by the hypothalamic pituitary axis. Hypothalamic gonadotropin-releasing hormone is secreted in a pulsatile manner from the hypothalamus. After binding to receptors in the anterior pituitary gland, the two gonadotropins, luteinizing hormone and follicle-stimulating hormone, are secreted into the peripheral circulation and stimulate the ovaries to produce estradiol and progesterone. Elagolix is an orally active non-peptide gonadotropin-releasing hormone antagonist that leads to a dose-dependent suppression of gonadotropins and sex steroids.
Now, advantages and disadvantages. Advantages. Studies have shown that this oral gonadotropin-releasing hormone antagonist is effective in the management of endometriosis-associated pain. It is well tolerated, and the side effects have been described as mild or moderate. Disadvantages. The three most frequently reported adverse events were hot flashes, headaches, and nausea. Here's a video in which there's a testimony.
For 24-year-old Brittany Barnhill, living with pain is a daily reality.
I've been in pain for most of my life, I guess I would say.
She began having debilitating menstrual cramps when she was only 12.
When I was younger, I would schedule absences at school based around my pain.
When Brittany was 15, doctors diagnosed her with endometriosis and she began treatment. But true relief was still out of her reach.
Some of the pain medication that I was on to try to control it would make me really drowsy and sleepy. I wouldn't really be able to function.
Because it cycles just like the lining would if it was inside the uterus. It can cause pain, discomfort, and long-term issues can cause infertility, pain with intercourse, and those kinds of things.
Brittany recently entered a study under the guidance of Dr. Randall Robinson at the UT Health Science Center and is now taking a new drug that promises to provide pain relief with minimal side effects.
It's been going really well. I have had less pain, I would say.
The pill is called elagolix. Patients take it every 12 hours, every day of the week, no matter if they have pain, and it's not a narcotic.
Once you have the diagnosis, it's something that you may have to live with for the rest of your life. So that's why controlling pain, affecting quality of life is so important for these women.
Now, conclusion. There is no cure for endometriosis, and patients are in need of additional treatment options to help manage this chronic and painful disease. Elagolix, according to recent study data, may offer reduced side effects. The study results presented that elagolix has the potential to be an important treatment option for women suffering from pain related to endometriosis. Thank you.